All right, everyone. Next up, really excited to present James Pierre-Glaude. James is a clinical assistant professor, and he's sorry, mouthful. Okay, let's try again. There we go.
Sure.
How's it going, everyone? Here, excited for our next segment. We're going to talk about cultural competence and disparate health, the bridging the gap approach for athletic trainers. I'm really excited to have James Pierre-Glaude here. He is a clinical assistant professor at Stony Brook University. He's also the director of sports medicine and sports performance for the US National Amputee soccer team. He was a presenter at NYSATA 2022 this past weekend. And JPG, we're really excited to do some key takeaways on this topic. Let's get into cultural competency. This is really the foundation of your whole talk. Why is it important for athletic trainers to be aware of this? And, how is it impacted pertaining to the drivers of health and the social determinants of health?
Well, first, before I answer that, Ryan, I'd like to thank you for inviting me to have this conversation and having and seeing value in discussing this topic with athletic trainers. In particular, cultural competence is a process in which healthcare providers continuously strive to achieve the ability to effectively work within the cultural context of the patient. So I know that's a mouthful, but a quick way of describing it is it's the process in achieving the tools and the skills to be able to connect with any patient that comes to your door, regardless of their identities, regardless of their cultural background. I think it's important for us to emphasize this in not only athletic training education, whether it's future clinicians or current clinicians, but I think it's important to include this because for many reasons. One, the demographics of this country is changing. I know that there is an emphasis on racial and ethnic data out there on demographics of this nation. But even when we take that out of the equation, we have people with varying gender identities and gender expressions, various ability levels, different faith systems that people believe in, and maybe individuals also have varying romantic orientations or sexual orientations. And so with that varying, within our patient population, as clinicians, we're more likely to interact with someone who does not identify with our cultural backgrounds or does not identify with the same social identities that we may have. So if we're not having these cross-cultural experiences, it's really difficult for an athletic trainer to be able to effectively connect with their patients. Another reason why I think it's important is communication. Your patient is much more likely to be compliant and adherent to your medical advice if they truly believe, genuinely believe that you care for them. And it's not just an act, and you're not just, filling a checkbox and moving on to the next patient. I think it's very impactful, even as a patient myself, when my clinician takes the time to find out who I really am and how their decisions affects my ability to be me. And I think that if we put ourselves in our patients' and clients' shoes, it's a no-brainer to, buy into being a culturally competent clinician.
That's so important. I'm glad you mentioned that. It's not just what we know as clinicians, it's how we apply what we know and being able to apply that to a diverse range of patients. And, in your presentation, you talked about athletic trainers typically only do what they're comfortable with, and we have to go outside our comfort zone to learn more about this, to be able to work on an ongoing basis. This is a non-stop process. It's ever changing to be more effective in this. So that's crucial for us to keep that in mind. And it's not just you read a book and you're good, or you take a class and you're good. And also you talked about in your presentation that like 70%, I think you said, of the drivers of health, 70% of the outcome is based off of that experience of the social and economic environment and the health behaviors of that person. I think like 20 to 30% of it is only just the exact clinical care and the environment, physical environment of your office. So that's a huge impact of the background and the other influencing factors that come into the healthcare. And I'm really glad you brought that to light. And one of the tools that you use to find those factors and identify how you can best help, you talked about those competency models, and specifically you talked about the ASKD cultural competency model. Can you talk about that a little bit and help us understand what that might be?
Yeah, sure. I'm a little biased. I really love the work of Dr. Campina Bacote is her name. She's out in Cincinnati. She has her constructs of cultural competence uses the ASK acronym. So the A stands for awareness. As a provider, as a practitioner, are you deliberately aware and sensitive to the values, beliefs, and values, beliefs, and practices of your client's culture? As a skill, do you have the ability to collect relevant cultural data regarding your patient's health history and present illness? Are you able to conduct a culturally biased physical and subjective exam? K is knowledge. Do you have the ability to seek, or it's actually the process of seeking sound educational foundation concerning the various worldviews of different cultures, right? We don't have to be experts at every single culture, but it is good to walk into that interaction with some sort of knowledge of varying cultures outside of your own, right? It's just more tools in your toolkit. E is encounters. This is the process which encourages providers to engage in cross-cultural interactions. What does that mean? How often are we in a room with individuals who differ from us? How often do we read or email or text or listen to individuals that may come from different parts of the world, speak different languages, have varying faith systems, right? So her take home point there is to vary our surroundings. That can help us implicitly or passively increase our ability to become more culturally competent. And the last one is D, desire. Do you even want to do this? Are you motivated as a provider to engage in the process of cultural competence? It's not a journey, it's a process. Once you said you've reached there, then you've probably stopped learning or stopped growing as a clinician.
And I want to just really hone in on one point that you made, which is so crucial, is you don't have to be an expert. You don't have to know everything. But if you just can speak to it, demonstrate it, showcase awareness of even small aspects of their own cultural background or ways to connect with them, they're going to feel that connection subconsciously, and then, like you said earlier, be more open with you with conversation, trust you more. So you don't need to expect that you need to know everything about a culture, but if you can know a couple key things about it that are important, then it just shows that you have that interest in learning about them and putting yourself in their mindset and their experience, which is crucial. Because I think a lot, athletic trainers, we like to dive into things. We want to know everything. We want to be experts on everything. And it's overwhelming if you try and do that with the wide scope of areas that makes up cultural backgrounds. So it's crucial that we just be aware and listening more than anything, listening and self-awareness to be in tune with that person that you're with. So it's crucial. Why do we really, the bottom line, clinical bottom line here, why do we need to invest efforts into this? What that connection between enhanced cultural competence and the patient outcomes?
So there's lots of data out there that talks about the benefits of cultural competence in the benefits of cultural competency training in healthcare. So definitely improved health outcomes. Where does that come from? Improved health communication, right? The ability for you and your patient to effectively communicate values, beliefs, wants and needs in an efficient manner. Also improved patient adherence and compliance. A patient is not going to follow your directions because you're the best person that ever did a lock-ins on them, or ever did a shoulder move on them, or you can recite the normal ranges of motion for shoulder active range of motion. That's not what a patient is necessarily looking for in that interaction. They love for you to know those things, right? But they're really looking to see, can you connect with them as an individual? It also makes patient education better. If you know um, what your patient values and what their health beliefs are, then it allows you to hone in on some items that you think is salient to that conversation, and maybe steer away from those that may be um, controversial for this person's culture, or not only controversial, but maybe downright that's a no-go, right? There's no negotiation here, right? And so as soon as athletic trainers and other clinicians can remove themselves, their own beliefs out of it, I think we can be able to connect with the patient a little bit better. A few more points on the disparate health part. Um, it increases, a culturally competent clinician increases the likelihood of patients who identify who are underrepresented or have been historically marginalized. It increases their likelihood of actually seeking healthcare.
Mm.
If this individual has had numerous negative interactions with healthcare providers before they stepped foot in your office, they're going to hesitate. They're coming in with negative energy. They're coming in with a cloud on top of their heads, and they're putting it on top of yours too, right? So all in all, it allows the provider to develop trust and create partnerships with the patient, and that is key when providing care for our clients and patients.
Great stuff, JPG. I'm really glad that you presented this topic, and it complemented all the other clinical topics very well, because if you don't have this key down and you don't have a focus on this, all the other stuff that we learned over the weekend are harder to implement with your patients and athletes and clients across the board. So thank you so much for bringing this topic to light, for talking about it. And before we go, I want to just give a special little note, because I love what you're trying to do right now. You're already, your involvement with the US National Amputee soccer team. You're both a PT and an AT. But you said that you have a residency. You're trying to get more athletic trainers involved in these activities. Tell us about that. What is this residency, and how can people get involved if they want to learn a little more?
Okay, thank you. I usually mention to folks when I talk about anything diversity related that it's not just talk, and it's literally the way I live my life. So, I'm fortunate enough to have the opportunity to work with athletes with very varying ability levels, and I have been involved in some other projects outside of amputee soccer with adaptive sports, but specifically to athletic trainers. Last year, I was able to start we'll call it a residency program, though I know that will have to go through some official processes for it to be formalized. But I do have a program where I invite athletic trainers, physical therapists, orthotists, and prosthetists to be part of our sports medicine team. They all you have to do is go to www.usampsoccer.org and fill out a contact form, and I get back to you. We do have a 5-hour workshop, and we invite you down to one of our training camps. I just came back from Dallas literally this morning, and able to host some clinicians there. They learn about the sport. As athletic trainers, it's really more about um, um, treating and interacting with the the non-abled body athlete. So it's a little bit different in some of the pearls there. So if you're interested, we'd like to have you down.
That's fantastic. I'll put that information in the show notes with that website. Anybody's interested, reach out to JPG. Thank you so much for your time. Looking forward to putting this information out there. And I really, it was great to meet you this weekend and look forward to future collaborations.
Thank you, Ryan.
All right. Have a great day.
Same.